Dr. Moore at Lone Star Animal Hospital, and we put together a list of questions that are commonly asked of us about cat dental disease. So I've got somebody who's going to throw those at me right now, and we'll see if we can get some of these answered for you. What's our first question?
What's important about cat dental health for their overall health?
So cat dental health, of course, is very important for can they eat without having pain? Do they have an overload of bacteria in their mouth? Do they have abscesses hiding under their gum line that we don't know about? So certainly that affects the immune system, how they behave, and really if they're comfortable or not. So there's really a lot that factors into oral health in their everyday life.
What are some signs and symptoms of dental issues in cats?
So sometimes they don't stop eating, but when we look at them, we're going to lift their gum line, lift their lip, look at their gum line, look for gingivitis, that bright pink line that you can see sometimes at the margin of the tooth in the gingiva. We're going to look for gingival recession, deep pockets. You can't see abscessed tooth roots without an x-ray, but sometimes there will be a swelling, either above where that root's sitting or sometimes even without opening the mouth, like right under the eye if a fourth premolar is abscessed. You can appreciate a swelling. So we're looking for periodontal disease under the gum line, and to some extent the amount of tartar and plaque that you can see on the crown of the tooth can be indicative of what's happening underneath the gum line, but sometimes we don't actually know what's happening under the gum line until we get in there with a probe during a dental or really more specifically with our dental x-rays. That's really where we find true dental disease, periodontal disease.
So what are some dental treatments that you would offer for cats if you're finding issues?
So let's say we have a cat that's getting a dental and we found a tooth with a deep pocket or an abscess root tip. Really that tooth is best served to not be present anymore. Certainly in certain cases a root canal is maybe a possibility and something to discuss with your vet. Most of the time not so much, but we oftentimes will extract a tooth that is not able to be saved. If you just do antibiotics, you are just band-aiding the problem for a very short period of time, and then you've still got a problem tooth that is causing that cat discomfort, pain, and infection. And so oftentimes we're talking about extractions, and they feel so much better with these problem teeth gone.
Are there things that we should be doing at home to take care of our cat's teeth?
Yes, absolutely. We love to get owners involved with their cats' oral hygiene. If an owner can brush teeth daily, that is ideal. And really, if it just becomes part of your normal routine, it's not such a big task, a big ask to do that. So it can be a quick 20 to 30 second, just brushing the outside portion of the crowns of the teeth, and then they get some positive reinforcement and move on. But plaque will turn to tartar in 24 to 36 hours, so it really does need to be a daily event. Even if someone were able to do it 2 or 3 times a week, that's absolutely beneficial. A little bit harder to remember to do on that schedule, so daily is more ideal. But yes, if an owner can brush teeth, that's the best thing that they can do.
Where do we draw the line between what we can diagnose at home in terms of the cat's dental health and what we really need to, rely on a veterinarian to diagnose?
Yeah, so if you think there's something wrong in your cat's mouth, absolutely a vet needs to take a look. You may notice bad breath, and that's quite common, and that absolutely can be something more serious happening in the mouth. And so if you see that bright pink line that I kind of described that is gingivitis, that's the first stage of periodontal disease, and absolutely we need to be getting in that mouth, addressing the periodontal disease, halting it where it is, and hopefully preventing bone loss under the gum line from happening, because that's what's going to really drive our recommendation to end up extracting a tooth. We really like to catch these teeth before we get to that stage. So if you suspect something's going on, absolutely it's time to have a vet take a look.
Could dental disease make my cat sick? Like what do plaque and tartar have to do with illnesses?
So it can be, plaque and tartar to some extent might be cosmetic, but absolutely there is bacteria that is harbored underneath all of that. And if it's there, it's under the gum line as well. And so the immune system is dealing with that. Is there even more that's happening well under the gum line, like at the root tips that we can't see? Absolutely, it's a possibility. And so really what we're after when we're addressing dental disease for cats, pain and infection. And so yes, I think plaque and tartar to some extent is cosmetic, but there's absolutely infection associated with it. Any questions, please feel free to give us or your vet a call. We're happy to talk you through what we can, and really it's very helpful if we can really see what's happening so we can be much more specific about it. So call and make an appointment.